I want to say welcome to Foresight TV on this Independence Day weekend. It's hot around the country and it's time to celebrate. And I am really excited to have Howard Gleckman with me today to talk about the future of aging and senior living's role in that. Before we get started with our conversation, I am going to start with this. Hey guys, Steve Moran here. Well, Howard, welcome.
Thank you, Steve. It's great to see you. Great to be with you.
So let's talk a little bit about who you are, what you do, what your passion is relative to aging and senior living.
Sure. So I am a senior fellow at the Urban Institute. The Urban Institute is a nonprofit think tank policy research shop in Washington, D.C. And much of what I do is focused on aging policy issues, how we can do a better job delivering services to older adults, and how we can do a better job paying for the way we deliver services to older adults. I wrote a book about long-term care about 10 years ago called Caring for Our Parents. And that was a book really about families and the experiences that they had caring for older adults who were very frail and disabilities. It was based in part on my own experience. I was a caregiver for my dad and for my wife's dad. So I kind of know this from the professional level and also from the personal level.
And the personal level, I found I became a caregiver for my mom 3 or 4 years ago, and I thought that I would fare better because I'm an expert. And it was a pretty terrible experience. I learned in just a few weeks' time, as I ultimately got her into a senior living community, I learned things that I just didn't know about how difficult the system is. And then you're also a regular contributor to Forbes, which is where a lot of my audience, a lot of you are likely to say, oh, yeah, I've heard of that guy. I can't sure where. So anyway, so let's jump into it. Let's just talk a little bit about how you see senior living and what role it plays in this whole aging continuum, and what you like about senior living, what you think we might be able to do better as a starting place.
Sure. So start with the demographics, right? Because in the end, we were all sort of, victims of demographics. There's nothing we can do about it. Everybody knows about the increase in the baby boomers and the older adults. But the other half of the story that's very important to remember is that baby boomers had almost no children. And the number of caregivers who are family caregivers who are available to care for their parents is shrinking rapidly. There were 10 years ago 7 children of caregiving age for every person over 80, and that's going to shrink to 3 in a couple of decades. So not only are we all getting older, but we don't have enough people to care for us. That's going to require people to rethink really the way they get care, and the idea of having millions and millions of older adults living in single family houses in the suburbs just isn't going to cut it. The question is, what is going to substitute for that? And of course, the other issue that's on everybody's mind is, how did COVID change things? And I'm not a guy who likes to think things will never be the same, because things usually are the same. But I think post-COVID, things never will be the same. I think it was a real inflection point for older adults, for senior living, and we've got to work that into the equation. There's no simple answer to where we're going next. I think it's going to be a mix of things. It's going to be ALs, traditional ALs. It's going to be traditional continuing care communities, but it's also going to be things like group homes and senior villages and other arrangements that people make that are in some ways new and in some ways really kind of going back to what things were like hundreds of years ago.
So where do I want to start? So I want to start with the demand piece, and then I want to talk about people's attitudes on senior living. So Recently on LinkedIn, a senior living executive posted a graphic that the American Senior Housing Association published on expected demand. And what this demand chart shows is that starting in 2025, they expect a incremental increase in the need for senior housing units of 100,000 units a year. According to Nick, in the best years, senior housing has created about 40, 50,000 new units. So the point that this person made was that we're going to need, starting in 2025, essentially the equivalent of 2 new Brookdales every year to keep up with the demand. What do you think?
So I think the demand question is interesting. Again, lots of baby boomers getting old, and as everybody on this show knows, it's not about 65 when it comes to really needing care. It's 70s and 80s, and that's when the 2025 is gonna matter. So sure, there's going to be lots of bodies. There's going to be lots of people who are going to need care. The question is, can they afford private pay care? And the way it is designed now, I think the answer for a lot of them is no. Everybody's been talking for decades about that middle market. How are we going to get the middle market? And they're still talking about it. I mean, nobody's got a good answer. And I know we're talking about the demand side, but in a few minutes, if we talk about supply, we're going to talk about costs. And costs are going to continue to rise. So you have a product that's already unaffordable and your costs are going to go up. Where's the money going to come from? Americans are not saving any more than they ever did. Maybe they did last year because they didn't have any place to spend it, but that's not going to last. People are not buying long-term care insurance. So where's the money going to come from? And I think that's going to be another critical issue. We'll have a population of well-to-do older adults who will be very well cared for. We'll have a population of very poor people who will get some safety net care, not great, but something. And then we've got this population of middle-income people who did everything right over their lives, but they couldn't save because they weren't making enough. And what's going to happen to them? And I think that's the question. And from the business perspective, I think the interesting question is, can you create a senior living model that's affordable for middle-income people? And the answer, I think, jury's out on that question.
Yeah, I kind of tend to think that that model exists, and if people are willing to relocate geographically, there are places particularly in the South, in the center of the country, where you can find assisted living for $3,000 a month. And you can find the other thing that I see, at least here in California, even here in California, is there's a lot of residential where you can do it for much less money than a traditional, if you will, big box senior living community. Mm-hmm. The other question I have, sort of related to that, is that right now, senior living is still largely seen as the choice of last resort. I was in Las Vegas at a conference last week, and I was on a panel with an operator, and the operator asked the audience of about 200 people who were really focused on healthcare more broadly than just senior living. How many of you plan on moving into a senior living community? And they raised their hands, but it was probably certainly less than 10%. So how do is that just always going to be the prevailing way, or do you actually see a place where senior living could be the cool place to go when you get older?
So I had a couple of thoughts. So one of them is, I think it's important to separate out nursing homes, who they're in a special situation. And right. I think the nursing home that we have known for 40 years is a goner, frankly. I think that business model is going to change in fundamental ways. Then you've got everything else. And I think the everything else piece of it, look, if you ask people, where do you want to move to when you are old and frail? They don't want to think about that answer because they don't want to think about being old and frail. The time will come when a lot of the people in that audience are going to have to make a decision. They'll probably make it too late, right? They'll wait until after they have a medical crisis, but that's kind of the way humans are. but then they're going to have to choose, because they're probably not going to be, many of them will not be able to stay at home. And so the question is, where do they go? And there, I think people will have many options. So there'll be the traditional kind of big box, apartment, 12-story apartment unit, or, big senior development. But I think there also are going to be small homes with maybe 8 or 10 residents. We'll see that. We'll see different models that will make it easier for people to stay at home. The idea of senior villages, where you get people in the community who join a nonprofit to help each other out. And that doesn't help you for all of your life. The time will come when that's not going to work and you're going to need more assistance. But it can put off the time before you move, which raises other interesting issues, which is, if you're running a senior living community, are the people who move in going to be older and frailer in the future than they are when they move in now, right? What you want, of course, is you want somebody who is 65 and healthy. But it may be, as you look to the future, that the population is going to be older and frailer. So that's going to be an interesting challenge.
Okay, I got to ask this question.
Sure.
It's easier to ask this than to a CEO of a senior living community. Would you move into senior living in another 10 years or 15 or 20 or whenever that time comes?
So, Steve, the answer is I don't know.
Okay.
I honestly don't know. I live in a single family house in the suburbs, but it's on one floor. My wife, who is a hospice chaplain, when we looked for a house 25 years ago, when we were much younger, said, I want a house on one floor because I want to be able to age there. So will we do that? Will we hire a live-in aide to take care of us when the time comes? Maybe. Short answer, like the people in your audience, I don't know yet.
Okay, so let's talk about the role of government. I mean, this is an area you're really an expert in. Let's talk about the role of government and senior living. There's so many places to go. Maybe we'll start, but I want to divide it into really two categories. One being the nursing home segment, and the other everything else, but primarily focused on assisted living. So let's talk about the nursing home side of things first. There's the big challenge that both sides have, of course, is staffing. It's hard to hire staff. It's important. Nobody's really able to pay a living wage, or hardly anybody is. What role does government play in this, and where do you think the government's going to go, particularly relative to nursing homes?
So nursing homes are a big issue. So you think about them, and the business model is bizarre. You have, in one building, you have people getting post-acute SNF care, and then you have long-stay residents. And we learned from COVID, putting those people together in the same place was probably not a great idea. I think that nursing homes have major problems, both on the cost side and on the revenue side. On the revenue side, where do they get their money? They get the long-stay money comes from Medicaid. Nobody is talking about increasing payments to nursing homes under Medicaid. A lot of talk about more federal money getting put into home and community-based in Medicaid, but nobody's talking about throwing more Medicaid money into nursing homes. So you've got, rising costs and no higher reimbursements on that side. On the SNF side, in some ways, you've got even bigger problems. So traditional Medicare pays $500 a day for rehab, post-acute. Nursing homes for decades have used that money to cross-subsidize the Medicaid. Managed care, which is increasingly becoming a bigger part of Medicare. Medicare Advantage is now 40% of Medicare. They don't pay $500 a day. They pay closer to $400 a day. So the reimbursement rate is going down. You're getting more and more people with post-acute needs who say, I will not go to a nursing home for rehab. They were saying this pre-COVID, but they're really saying it post-COVID. You look at the NIC data. It's just going away, and the Medicare Advantage plans themselves are responding to that consumer demand by coming up with alternatives for people to get rehab at home rather than in a skilled nursing facility. On the cost side, you mentioned labor costs. There's also, PPE costs, which are going to be forever. I mean, this is not going to go away with COVID. You've got major recapitalization issues, which again are not new. They existed before COVID, but even more important now. A lot of nursing homes are really not set up for maximum infection control. That's going to change. The double rooms, I think, are frankly goners. The quads are absolutely goners. So I think the nursing homes have a huge problem. You're seeing it, a lot of consolidation already. Not-for-profits are in terrible trouble because they don't have the access to capital, because they tend to be smaller, all of that. I've heard people I respect in the industry saying half of operators are going to be out of business in a year. Not half of beds, but half of operators. So the nursing home world it's in a bad way. And they got a lot of money during COVID. They're asking for more. I'm not sure there's going to be a lot of interest in Congress in giving them more because so much of the focus right now is home and community-based care. There may be some deal in the end where they go along with Biden's proposal to increase home and community-based by a lot of money and throw a few dollars at the nursing homes just to kind of make them happy. But it's certainly not the focus. So the nursing home piece of that question is tough. The other side of it, the more private pay, everything else world, I think that there's some interesting issues there. So one of them is this focus on home and community-based care can include assisted living. There is some assisted living that's funded with home and community-based. There probably will be more as time goes on. There are lots of complicated issues about when you're eligible, when you're not, what kind of lock do you have on your door, and the regulations are crazy. But you've got to deal with all that. If you do, and if you're willing to take Medicaid residents, there's probably going to be an interesting business model there. There may also actually be, for assisted living, more of an opportunity in the post-acute world because they can do it for less money than the nursing homes can. So there's some possibilities there. In the strictly private pay market, I think we are in a period of transition. It goes to what I said before. The government's not going to pay for that. They're not going to pay for room and board. They're not going to pay for all of the other benefits that you get, living in a senior community. But there is another option, and that is there has been talk for years now about providing some sort of a public long-term care insurance program. The state of Washington has already enacted one, and there is growing interest, although it's still relatively small, but growing interest in Washington, D.C., to do something on a national level. So just yesterday, a Democratic member of Congress named Tom Suozzi introduced a bill that would provide a lifetime catastrophic long-term care benefit. It'd be funded with a payroll tax increase that would average $300 a year for a median income worker, so almost nothing. And it would pay over $3,500 a month in benefits once you triggered it, and there would be a waiting period that would be based on how much income you made. But it's an interesting model, and it would do what, from my point of view, needs to be done, which is it would get more money in the system. And that would, I think, reduce some of the pressure on the operators.
So if it were $3,500 a month, and I know this is making politics like making and legislation like making sausage, but as proposed, it would be $3,500 a month, and that would be on top of my Social Security or whatever pension money I had coming in.
That's right. This would be it would work in some ways like a long-term care insurance policy. So you would still have to trigger it with a need for assistance with 2 ADLs. There would be this waiting period that would start. It would be for lowest income people, it would be 1 year. So after you trigger the benefit, you would still have to wait a year if you're very low income. If you're very high income, the very highest income people would have to wait 5 years before it triggered the benefit. So for a lot of them, it wouldn't never really use it. But it would be available for those people who, for example, have dementia, who might have very long spells of a care need. So it's there for them. But after this waiting period, after the benefit is triggered and you go through this waiting period, you would get this benefit. It would be a cash benefit, so you could do whatever you wanted with it, within obviously some limits. But you could do essentially whatever you want. If you want to use it to pay for a CCRC, you could. If you want to use it to bring in an aide, you could do that. You could do whatever you want.
Yeah, it's really an intriguing idea. I think that one of the challenges that, or the sort of a set of challenges that I see is that um, my guess is that if you were to look at the current nursing home population, and I think there's going to be some variability from state to state, that some portion of those people in nursing homes could get the levels of care they need in a medically based assisted living model. And the only reason they're in a nursing home rather than assisted living is because of economics. So government will pay for, Medicaid will pay for nursing home. They won't pay for assisted living, except, some states, of course, have the waiver program where it's better. And it would be really interesting. I'd love to hear your thoughts on what that might look like. And from an operator standpoint, double-edged sword, right? So the idea of having more people who can afford it sounds really good, but then the question comes is, do I get more regulatory oversight, which actually makes it more expensive and more difficult, not worth it?
Yeah, the regulatory oversight is a huge issue. So if it's a long-term care insurance program, I think there's probably less chance of a lot of regulatory oversight because it's not a government program. It's essentially an insurance program. You get your benefit and then you go just do what you want. If it's something like Medicaid, I think you're going to see more and more regulation, particularly again post-COVID. One of the things that terrifies me, and people in your audience will remember this. We went through this with Falls, years ago. We went through this with environment years ago after some fires. They will put in so many regulations to protect against viral infections in nursing homes that they will make it an absolutely miserable place to be, right? You and I can both imagine a situation where nobody gets COVID or nobody gets the flu in a nursing home, but you'd be locked up in your room, which is what we all just went through for a year. So I think the regulatory pressure on nursing homes is actually going to grow because of COVID. I think these other issues, though, I think that we can avoid a lot of the regulatory problems and simply give people a cash benefit and let them decide. The other question you raised, which is an interesting one, which is, can assisted living provide a sufficient amount of assistance for people who really have very high levels of need? And again, I think the industry has got to decide, and it's not going to pick one or the other, it's going to pick both. But operators are going to have to decide, do they want to be essentially a medical model or do they want to be basically a hospitality model? And I think both can work, but you're going to have to make a decision which one you're going to do. And certainly, we've been talking around it a little bit, but the labor force issues, I think, are going to be a big part of that decision.
So, yeah, I talked to Martin Parkinson 2 months ago, and he strongly disputes my premise that there are many people in nursing homes that could live adequately in assisted living if it weren't for the economics. Thoughts on that?
Yeah, so I vote for you. No offense, Mark, but I vote for you on that. Yep. I mean, there are 700,000 long-stay residents of nursing homes. So about 1.4, 1.5 million people living in nursing homes. About half of them are in the post-acute side and half of them are in the nursing home side. So you get about 700,000 people. If you look at the medical conditions of the people who are long-stay residents, and the question is, do they need skilled nursing? My best guess is probably 200,000 of the 700,000 don't need skilled nursing. They need a high level of personal assistance, but they don't need a nurse. They don't need an RN. So if they need a high level of personal assistance, they don't need to be in a nursing home to get that care. They're there because, as you say, that's where Medicaid pays. Medicaid pays room and board in nursing homes. It doesn't pay room and board anywhere else. And that fundamentally changes the equation. So we could get, again, these numbers are pretty rough, but I would estimate we could get somewhere between a quarter and a third of nursing home residents out of nursing homes if we could get them a good alternative. Now, I also have to say that the advocates out there who say, well, let's just burn down the nursing homes, turn them into parking lots, and send everybody home, that's not the answer either. An awful lot of the people who are living in institutional care cannot take care of themselves. And because they don't have family caregivers at home, it just isn't possible. So they need some institutional care somewhere. The question is where.
So the other question I have that I find really fascinating. So this, by the way, I just want to say this conversation is a little depressing to me. Um,
Everybody
so
says that to me.
I shouldn't laugh as I say that because it really is true. But the other question I have is ACA last week, or maybe this week, earlier this week, came out with a study that said something like 40% of operators, both assisted living and skilled nursing, are saying they're operating at a loss, and that again, I not as prepared as I should, but something like 25% said they didn't have the resources to go more than another year. What happens if in fact the government doesn't step up? I mean, are we going to see a massive closure of nursing homes, and then what happens?
I think you're going to see, I think you're already starting to see a massive consolidation of nursing homes. I think it's a subtle but really important difference. I don't think the beds are going to close. Some will, but not that many. But I think the operators are going to go out of business. So what was it last couple of weeks ago? Bon Secours announced that they're closing all of their nursing homes in 3 states in the Midwest. I think that's what you're going to start to see. Now, those nursing homes aren't going away. They've been sold. They're going to picked up by some private equity outfit, and they're going to run them. But it's going to change the model, and it is going to require the new owners to make a decision about what they want to do with the space. Do they want to keep the CON? Do they want to keep the license and keep it as a nursing home, or do they want to turn it into something else? And there, I think you're going to get a variety of answers, right? Some of them will keep them as nursing homes, and also let's face it, all healthcare is local, all long-term care is local. We have some communities, including the one I live in, which are wildly overbedded. We have way too many nursing home beds, and then we have other communities, particularly rural communities, they're in desperate need of them. So this is going to require, I think, some moving around of resources as well. But if you're in a place that's overbedded, the suburbs of Washington, D.C., there are a lot of rich people. There are a lot of people who have insurance, but they're not that many. So I suspect we're going to see around here, we're going to see some beds close. I talked to somebody in the Boston area telling me the same thing. So yeah, they'll go away. And then the question is, where are people going to go?
Yeah. Well, the other thing that's related to this question I find really interesting is I think it was New York Times maybe 6 or 8 months ago had an article talking about the nursing home crisis in rural towns. And of course, what's happening is people are moving out of these rural towns. There's typically one nursing home. Nursing home occupancy starts going down, and then on top of that, finding staff to come in and do it. I think they're talking about places where they have to bring in nurses from 100 miles away to be able to staff it, and it describes as a real tragedy. But I guess the question really, and maybe it's a societal question as much as a governmental question, is if I'm the last person left in the town who's over 80 or over 90, do I deserve to be able to stay in that nursing home because that's where I've always been?
Steve, this is the same question we've asked about rural hospitals,
right?
And we've answered that question, which is we're going to close the rural hospitals. I'll tell you an anecdote. A very dear friend of mine 3 weeks ago who lives in rural Montana had a heart attack, and they medevaced him to the nearest acute care hospital, and he saved his life. He's fine, but I think if you add up the numbers, it's going to turn out to be far more cost effective to medevac that handful of cases that needs to go to an acute care hospital than it is to keep the hospital open and half empty most of the time. So we've answered it with hospitals, and I think we're going to have the same answer with nursing homes. People are either going to have to go up a big distance, which is going to be very difficult because, when you do surveys of families and you ask them, what's the most important, factor in their decision about what senior living facility to move their parents, the answer is location, location, location. I want something that's close to me so I can go visit. If you have somebody in rural Montana and they got to go 100 miles to visit their mom, that's going to be a challenge, and that may mean that more people are going to choose some sort of home care. But then the question is, where are the licensed aides? There are no aides out there either. They're not working in the nursing homes. They're not working in home care either. So that creates another situation. I was looking at a study the other day that said that, this is the first study I've seen like this. It's trying to count the number of gray market aides that are out there. Mm-hmm. And it estimates that 30% of home care aides are gray market or off the books. And it may be more than that. I think it probably is more than that. But they came up with by surveying clients, they came up with an estimate about 30%. And I think you're going to see more of that. You're going to see more people who are just going to hire, the woman who lives down the street who's a retired nurse, or maybe doesn't even have any sort of license, but she's kind of empathetic and has some basic skills, and that's going to create another whole set of challenges. Yeah. But I think we're going to see a lot of that.
Yeah. Well, I know just in my church environment, I know a couple of women who, for one reason or another, are not employable through traditional sense. These are, not from an illegal alien, but they've just other things in their lives. Mm-hmm. And they do work for other women, typically older women in the church who need help. Sure. And I suspect there will be a lot of that. It's this whole idea of where I get to live is such a hard thing. My in-laws lived in a little town in Northern California that was 45 minutes away from the closest hospital. Mm-hmm. And they knew that when they moved up there. They were middle 60s, late 60s, something like that. And to sometimes people make these choices that you could call higher risk. I think it's much harder when you talk about somebody who grew up in a town who had a nursing home and you thought everything was going to be okay and it disappeared. But I guess ultimately, I don't think the government's going to help me go live in Beverly Hills because I want to live there, even though I can't afford it.
No, that's right. And look, I mean, this question of risk, we could have a whole other conversation about this, but this question of risk in old people, I mean, you got a right to take a risk. Why not? And if you could live in some place that you really love and you can enjoy it for 10 years, and then something catastrophic happens to you and you didn't get to the hospital and you died, well, you had 10 good years in a place that you love. And is that so bad? I'm not so sure it's so bad.
Yeah, no, I don't think so. I think this regulatory process is one of the things that's a huge conundrum for operators. I belong to a Facebook group for activity directors, and there was this big discussion about whether or not to serve alcohol to nursing home residents. Right. And it was kind of alarming that it was so parental. We're not going to let them because it's not good for them. And it's like, I should be able to make that decision for myself as an adult, even in a nursing home.
So, but you've got to, of course, keep in mind the role of the family in that. I'll tell you a funny story that I heard 5 years ago. Nursing home operator in New England, same thing. He was having a happy hour, and the residents loved it. And one day, the son of one of the residents came in and saw his dad, who in a wheelchair, drinking a beer. And the son went off on the nursing home operator. How can you let my dad do this? And the operator said, well, don't worry about it. We don't let him drive after he had his drink. And he said, the son didn't laugh, and I knew I was in big trouble.
Yep.
And they ended up canceling the happy hour because a couple of adult children freaked out and complained. So this is not just the regulators. It's also about the kids and all the crazy dynamics that goes on with the kids who feel guilty that mom's in the nursing home and they don't like it and they take it out on the operator and make it miserable for everybody. So there's that too.
Yeah, these are all, it's really difficult. It's interesting. I met a guy last week who runs a adolescent the home for kids who are really out of control to get behavior back in. And one of the things he does is that he actually forces the parents of these kids to go through some educational process, and he won't take the kid. And I got to thinking, he was telling me the story that maybe we could make senior living on a whole lot better is if, as a condition of moving their family member, and the families had to go through some educational process too. It's an intriguing. I'm going to spend some time thinking about it, but I'm going to write about that at some point.
It's a great idea. I'll tell you a place where it's really interesting. and it's about expectations. I've done some writing about this question about what do you do with residents who have advancing dementia, and do you keep them with the residents who are cognitively intact? And this, of course, always comes up in the dining room. Some residents say, I don't want to have dinner with somebody who's not all there.
Right.
And what I found is the places that can successfully do that are the places that, in fact, up front, say to the families, this is how it works here. And yes, your mom right now is coming into this facility and she's cognitively intact, and she may feel a little uncomfortable because there's somebody at her table who's got some dementia. But you know what? It's good for that person. And when it happens to your mom, because it probably will, when it happens to your mom, she's going to be able to sit with her friends, even though she's not quite as intact as she was. And what the operator told me was, when you do that, when you're upfront with everybody about what the culture is of this place, you get more buy-in from the beginning and less of that resistance from the families. So I think you're exactly right. You've got to do that.
Yeah, I do. I think that the setting the expectations is so important. So we've blown through my time schedule. We've blown through my bonus time schedule. This has been great. I just really appreciate your wisdom. Love to be able to do it again. For all of those of you who are watching, I would love to invite you to join our texting community. We're not selling anything through it, just bonus content, sometimes just a little love. All you have to do is text 916-659-5287. There's one thing I need to tell you about this texting community. When you text it, you're going to get back a text asking you for more information, which mostly will be fine, except for one thing. It's going to ask you your birth date. If you don't want to tell us your birth date, it's okay. Lie. We don't care. Even if you want to, we'd love to have you maybe give us the day and month, but lie about the year. Make yourself look 200 or 2. We don't care about that. I just don't have any control. I don't have the ability to turn that off, or I would. Howard, thank you very much. Have a great week, Independence Day weekend. Stay cool. Watch your area is probably the best place in the world to be watching fireworks, right?
Absolutely. It's great to be with you. Thanks a lot for asking me, and talk to you again soon.
Very good. Thanks so much.